Commissioner Raquel Regalado. Many of you have been calling and emailing our office asking about neurodivergent children and adults, about masks and about vaccines. So we put together this roundtable to talk specifically about neurodivergence and all the questions that our parents have been sending in. So I would like to thank for joining us, Michael Alessandri, Executive Director of Center for Autism and Related Disabilities, UMNSU CARD, Matthew Love, President and CEO of Nicklaus Children's Hospital Systems. We also have with us Dr. Marcos A. Mestre, Vice President and Chief Medical Officer for Nicklaus Children's Hospital Systems. Thank you for being with us, gentlemen.
Great to be here.
Great to be here. Thank you.
Thank you. So we've gotten so many questions. I'll start off by saying that for my kids, at first, the masks were really difficult. As I've mentioned to some folks who have asked and have seen it on Instagram and other social media, I first got Isabella that bucket hat with the plastic. And when she was tired of walking around like she worked in a beehive, then we transitioned to the face mask, to the face shield, and then we transitioned to the mask. And now she actually wears the mask all the time. We actually have to remind her to take off her mask, because if she really likes the mask, she will in fact wear it to bed. Sebastian also goes around telling folks to put on their masks. But I think it's an opportunity to talk about how, if you've met an autistic person, you know, you've met one autistic person. Every neurodivergent person is different. You know, some of them have taken to the mask, some of them have not. Some of them, it's a daily challenge. Michael, I wanted to ask you about this. We'll start with that because at the school board, they had this health committee, and there were some comments made about neurodivergent students that have brought even more questions than we were getting before.
Well, nothing's without even more controversy, I guess. What I would say is, and I think I just want to piggyback on what you said, when you've met one child who's neurodivergent, or I'll talk about children with autism because that's my expertise. You've met one child with autism. So a one size fit all approach, despite I think the reality that we all face, which is we are in a global pandemic, and a one size fit all approach would be great if that in fact were possible, but it's simply not possible with the population that we work with. You know, great for Isabella that she can tolerate a mask and even enjoys wearing the mask. We have many other success stories like that as well, but we have many, many more stories of children who are simply not able to tolerate the mask, or who simply haven't mastered the task of learning how to wear a mask for the period of time that they're required to. So I hope the school board and I hope other institutions find a more nuanced, more compassionate way forward, because we can't simply ask these parents of kids with severe presentations of autism to keep them home, to keep them disengaged from families, to keep them disengaged from their therapies, to isolate them even more. They're missing out on critical developmental opportunities because of this inability to engage with the rest of the world because they can't wear a mask. So I don't have all the answers. I don't have any of the answers, really. The other two gentlemen probably do, but we have to come up with better solutions, and we have to engage the parents in finding those solutions. There have to be better compromises, I think, going forward, at least over this next period of time. And I think it speaks, trying to protect the most vulnerable speaks to the importance of getting as many people vaccinated as possible, I think.
Agree. And we're going to be talking about that. But really one of the things that I wanted to ask you, Michael, was, you know, one of the things that we're considering is an opt-out by a pediatrician. And we're actually going to be talking to Dr. Mestre about that. But, you know, for the children who absolutely can't, you know, what have you been telling those parents in terms of what they should be considering?
Well, I do think it's important to speak to their medical provider, first and foremost. I'm not a medical doctor, so I have to state that out of the gate. I'm just someone who loves the autism community and is always trying to come up with compromises and solutions that better serve that community, particularly those kids and families that are affected by more significant presentations of autism. The nonverbal, the severely intellectually disabled, really compromised behaviorally. Those are kids that, you know, shouldn't be excluded from all those entitlements that they have in terms of learning because of behavior related to their disability. So speak to your medical professional, contact us at the Center for Autism for strategies that we can give you to help promote better mask wearing, educate your teachers about how to engage kids more safely in the classroom. There are other things you can do: social distancing, setting up the classroom more creatively, working with your staff to create pods of students, I think, within the classroom. Again, I don't know all the answers to this. I think every classroom, every school entity is going to have to find a way forward, but we can't do that without engaging the families and just saying this segment of the population has to stay home. It just doesn't wash for me. So,
Agree.
but
And that takes
I
us
welcome
to,
any call from any I mean, maybe not any call, but I'll welcome calls from families who want help with trying to use some of the masking protocols that we've developed, some of the social stories we've developed. And I know we'll share some more of those as we go forward.
right. And I wanted to ask you about that. If you could tell us a little bit about the social stories and the options for parents, because that was really useful at the beginning, kind of explaining why we wear this, because that's the first question that a lot of them have.
Yeah, there's some wonderful social narratives. They're basically visual storytelling strategies that help children with disabilities understand. In the beginning, we did whiteboard videos of what is the coronavirus, and now there are other agencies as well as ours who've created social narratives about vaccine, about social distancing, et cetera. So they're essentially visual stories that we can share with families and try to promote a better understanding at the level of the learner with autism about what's going on in the world. Because it's, even though we were in it a year and a half, it's still confusing to get, why do I need to wear a mask? What is the coronavirus? Why do I have to stay away from people in terms of social distance? They don't understand all of that necessarily conceptually. So presenting it visually can be much more helpful to them. And we have tools that we can share. We even have tools about, getting the vaccine and working with our medical providers, and have worked with some local hospitals and local medical entities to create autism-friendly spaces for getting the vaccine and for getting medical care. And we're hopefully going to be partnering with the folks on this call as well. So there's a lot to do. And I think there's a lot of goodwill. And I think there are a lot of really well-intentioned people trying to keep all of us safe. But again, it's not a one size fits all. And we have to figure out better compromises, I think. And still.
So that takes us, Michael, to the vaccine hesitancy. And that's really what we wanted to focus on. We got so many calls about it. We're going to be looking at the different options. I just decided to negotiate with mine. Mine are a little older, so negotiation was on the table. For a lot of younger children, that may be harder. But speaking of the mask, even though she was good about wearing them, both of my kids wanted to go to summer camp, and they both wanted to be able to take off the mask. When I explained to Isabella that if she got the vaccine, she could go to camp and she could occasionally take off her mask, her response was, when can we get it? And that's exactly how that happened. But there's so much vaccine hesitancy, especially for parents who believe that vaccines are in fact the root cause of autism.
Yes, and that's a big conversation. That is something we can't seem to ever get beyond, unfortunately, despite dozens of studies which have exonerated vaccines as the direct causal link to autism. And there are many families who continue to believe that. And at this point, we just continue to share what the science has told us and try not to go backwards. But I have a young man with autism that works for me here, and he did not want his flu shot in the fall and did not want his vaccine this spring. But his mother did what you did, essentially. She incentivized him. She said, you can't go back to work at UM unless you have your vaccine. And he has been wanting to come back to work desperately. So he was able to finally allow himself to go and get the shot, and we'll be starting back at work actually on Wednesday. So we're happy about that. But there are ways to, parents of children with disabilities know the behavioral analysis interventions, using reinforcement, incentivizing certain kinds of outcomes with certain kinds of consequences. So I encourage people to use those if they're in fact eager to see their children vaccinated and able then to participate in all the things in life that they've been excluded from without the vaccines and without the ability to wear a mask. And I think the more people get vaccinated, of course, as I said before, the more we can take care of those kids who have more difficulty with masking and social distancing and all the other things that we're expecting of human beings right now.
Well, I know several folks that used a trip to Disney World as leverage, and that seemed to be very successful since a lot of folks couldn't go to Disney World.
That would be an aversive for me.
Same thing. I would be like, no vaccine for me, but my kids love it. But one of the things that the parents have been talking about, because we have parents that are hesitant, the ones that I've spoken to is, and then I want to go to Matthew on this. This idea of if your child gets COVID, they're going to be in the hospital without you. Isabella could never wrap her head around the fact that if something happened to her, I couldn't be there. And that's a conversation that has motivated a lot of parents to take that next step. So Matthew, if you could talk to us a little bit about what you've been doing in Nicklaus Children's Hospital, the efforts to vaccinate folks, and these rules that can keep parents and family members out of the hospital if something should happen to an unvaccinated child.
Yeah, absolutely. And first of all, thank you for having us here today, Commissioner. I think it's fabulous that you're a champion for kids, and kids everywhere. So thank you for doing that. And Michael, it's nice meeting you here on Zoom as well. So thank you for being here. First of all, I think, as the Children's Hospital in South Florida, right, we're fortunate enough, right? We have great physicians, great caregivers. And I'm going to talk a little bit about your question, Commissioner, here in 1 second. But, when I look at, the organization and how we've responded to COVID has been fabulous, right? It's been fluid over the last year and a half. There's been a lot of talk about different things. But, one of the things that we're most proud of here is that, and people have heard it, right? Parents have heard this. And even if you had to go to the hospital yourself, restrictions on visitors and those types of things, for us, we take very seriously, being a children's hospital. And I am so proud to be able to share that, we never eliminated visitor policies in our organization. And so, I mean, every child who came into our organization always had at least 2 parents that could be with them, or 2 people that could be with them at all times, coming into the doors inpatient hospital. So for parents that are afraid of that component, specifically in this time of the pandemic, I would say that's not us, right? We value the family, we value the parents' participation and care. And we're going to stand by that, on a go forward basis.
Thank you, Matt. When we talk about what your efforts to get children vaccinated, you guys were vaccinating children early on. At the beginning, we started with children that had cancer, were cancer survivors, transplant, and that was very successful. When we talk about neurodivergent children, what are you guys doing to accommodate them and those parents?
So we continue to have vaccination clinics for all kids. I think it's important for us to take a step back and say, vaccines are recommended for everybody, right? That includes adults, kids, and those with neurodivergent issues as well. So I think that for us, every time that a patient or a kid wants to be vaccinated, we'll do it. We have a clinic 3 times a week, Tuesdays, Thursdays, and Saturdays. If there's kids that have special needs, please call, make an appointment. We have folks to help you. Dr. Mestre, I'm sure, is going to talk about some of that in terms of how we do that. Because Michael, I love your words right earlier. One size does not fit all. And so, to me, that's what we believe here, right? Every kid is a unique individual. Every family is unique. And we're going to take care of every single one of those in a way that they need and what's appropriate for them.
Thank you, Matt. Well, that leads us to you, Dr. Mestre. How are you doing? We know that you've been at the front line. Parents have so many questions about vaccinations. Specifically, I had reached out to you initially because we had so many questions about sedation. Sedation is somewhat controversial. I've actually personally sedated Isabella for dental work. And I explained to the folks that asked me about it that it really is a last resort. It's very expensive. It's not covered by insurance, and it has a lot of risks. So if you could talk to us a little about what the options are for parents, like soup to nuts, so that the folks listening can kind of process that.
Sure. Thanks, Commissioner. So what we have here, and as Matt mentioned, in our vaccine clinic, we do it Tuesdays, Thursdays, and Saturdays. Tuesdays and Thursdays are from 7 a.m. to 7 p.m. and Saturdays from 9 to 2. And our staff, I'm always amazed by the work that they do. I'll give you a short story just in terms of a family member who wrote to us, and they said that they drove here specifically for 3 hours to get here. With their child with special needs, because they know how our staff handles children. Our staff is trained in terms of dealing with children with special needs, and therefore can cater to them in the best way. I guess that's the best description to give it to, and can even hold their hands, do it in the car, wherever it feels best for the child to do, we will do that. We also can involve our child life specialists if needed. And they are magicians, I always call them, in terms of being able to distract a child, and especially children with special needs, to not require that sedation that you mentioned. And you're 100% right. Those sedative measures do come with risks that we don't think are worth it in regards to vaccinations, but doing these other measures that we as a children's hospital specialize here at Nicklaus Children's, and no fault of their own, the folks at CVS or Walgreens, and they're doing a great job in terms of vaccinating, but they may not have that staff there to do it, where we here at Nicklaus Children's deal with this day in and day out 24/7.
Right. And look, I think, back to what Michael was saying about the social stories, it's easier when you do it in a hospital to explain why you're there. For the folks that I know that have considered like CVS and Walgreens and all these places, it's very confusing for the neurodivergent. Like they go there to buy candy, not to get like a shot, right? What are we doing here? There's all these random people, all these different things that can go sideways. So one of the things that we've all suggested is, try to go somewhere where the only thing that we're doing is this one thing. It's quiet. If there is a sensory room, if there is a quiet space, because the other thing I wanted to ask you about, Dr. Mestre, is the waiting time. So both of my children were vaccinated. We did it at Jackson, and we actually went to a facility where they recommended specifically for neurodivergent, and they had a sensory room where the two of them sat for the half an hour that they had to wait to see if they got a reaction. And it was very soothing. They know what a sensory room is. I told them that was the plan from the beginning. And all of that kind of made the process more predictable and reduced their anxiety.
Yep. And those are the things that we try to cater to here as well, and making sure that if they need a special room, sensory room, as you mentioned, in terms of away from the other folks who are waiting, we can accommodate to that. And that's something that our staff is accustomed to in terms of doing those accommodations for members that need it. And again, the wait times here initially, when we were coming out with the vaccines at first, the wait times were significantly longer. But right now, we don't require appointments. You can just walk in, and it usually the whole process takes about 30 minutes at most, in terms of from the time that you register, fill out the forms, receive the immunization. And the waiting time typically is 15 minutes for those individuals that have allergy tendencies. We do observe for a little bit longer, perhaps 30 minutes.
When we were talking earlier about the masks, unfortunately, we're seeing a lot of adolescents that are not getting vaccinated. What can you tell parents now that we're seeing more and more kids in the hospital?
Sure. Yeah, so we've definitely seen an increase in our emergency room visits and our urgent care visits. And secondary to that, unfortunately, more children that are requiring hospitalizations. And what I explain to parents, I'm a father of 3, so I understand where they're coming from. My wife and I are pediatricians, and we still had some hesitancy at first. And then we talk it through, go over the risk and benefits. Thankfully, so many people have received the vaccinations, and so many individuals that are adolescents have received the vaccinations, and they're incredibly safe in terms of the side effects are minimal, if any, at all. And the benefits are that you kind of try to get back to as normal of life as possible. And to Michael's point about what you mentioned earlier, if you have a family member that can't receive it, if you have a child with special needs that can't receive the vaccine at under 12 years of age, what I recommend is that everybody that's around that child to please receive the vaccination, because that's going to be the most important area where you're going to possibly get infected, is in the home. That's going to be the highest percentage chance that you're going to get affected, is in the home. And that the schools understand that and work with each family. Each family has their own story. Each family has their own needs. So I do please ask the schools to work with those families, as we do here at the hospital.
And now that we're talking about like masks and getting a note from your pediatrician, how is that going to work?
Yeah, so typically what we see is for medical exemptions, and there are certain children, as you mentioned, that for whatever reason may not be able to tolerate a mask. We can, again, going back to working with each family, perhaps it is wearing the hat with the visor around them that limits the risk of infection. And that's what it comes back down to, is the risk is never zero with anything, be it vaccinations, be it masks, it's never 100%. So what you're trying to do is just limit it as much as you can, but it's so important to get kids back in school, and especially those that are neurodivergent. They need that to thrive. And I think that's what we need. Our first priority is what do we need to do to get children back in school? And the two things that we always, our mantra is get everybody that can be vaccinated, and whenever possible, that individuals when indoors wearing a mask.
Thank you, Doctor. Michael, we started with you and we didn't give you an opportunity to talk about NSU card and the resources on this issue of the homeschooling. We've been getting so many questions, and I agree with you. I think it's so important for parents to understand, and for everyone that's watching, that our children have issues being social, but they're not antisocial. My experience, has been that more so than other people, neurodivergent people want to be around people. It's so important for their development and their growth. What do you think of this? Let's just keep them home, and that way we don't have to vaccinate them or worry about mass trend.
Yeah, as I said at the top here, I'm absolutely, kind of flummoxed by the idea that we would just opt to keep everyone home with autism who can't wear a mask. It just feels discriminatory. Let's just start at that level, because these are children who are engaging in a behavior that is directly related to their disability. We've been on the front lines for the past year and a half trying to create mask wearing protocols, behavior analytic based mask wearing protocols, and still it's very difficult for certain segments of the population to wear a mask or to keep a mask on for an extended period of time. So I worry that this hard and fast rule about no mask, no school is going to leave an already marginalized population further marginalized. I have deep, deep concerns about the long-term impact of these kids right now over this last year and a half not getting the kind of human contact that they need to get better. I think we're going to be studying this generation of kids for decades to come to see what the long-term impact has been on not being engaged with their family, not being able to hug their grandparents, not being able to be in a school with peers. I'm not dismissing the significance of this global pandemic. I understand these are life and death issues, but I think everything has to be put in its proper perspective in terms of risk to children and some of the mitigating things that you can do around those children who can't tolerate mask wearing. But again, I'm no expert. I'm just a kind of a common sense guy who happens to take care of 14,000 families of children with autism. So I have a vested interest in coming up with solutions that don't exclude them from the process and from the dialogue. So what I'd say is, if you are a parent of a child, excuse me, of any age in our community, Dade County, that has autism or a related disability, be sure, number one, that you're registered with the Card Center. We will connect you to a card case manager. Someone will be there every step of your child's life to guide you through these difficult decisions that you're making now and forever. So that's the first step. And we will provide you with the resources you need to make great decisions for your child. We won't necessarily have all the answers, but we'll be your partners in the decision making, which is the most important thing. And CARD has connections with all of the community stakeholders in this space, including all of the hospitals, all of the pediatric care facilities. We have a great project right now with Nicklaus where we're working on teaching kids driving using virtual reality. It's a new project we're developing, but they're developing and we're participating. And we've done a lot of autism-friendly spaces with Jackson and other pediatric dental facilities. So be connected, be engaged, walk alongside us through this journey with you and your family. These are difficult times, but they're a lot less difficult if you're doing it alongside somebody who cares and has some information that can help you.
Agree. Thank you, Michael. And so that everyone that's watching knows, I've said this a million times, I'm such a fan of NSU Card. I could not have successfully raised my children without Michael and NSU Card. We still laugh about when I put Isabella in the surf camp and then hid behind the bush with my coffee cup because I was certain that she was going to walk away and leave surf camp. But here we are, over a decade later. With wonderful, responsible, independent, adults, and I couldn't be prouder of them. It isn't easy, especially when they're little. But NSU Card has such amazing resources, and I always tell parents, everyone is scared. I was scared, but they're a tremendous safety net, and it's really the caseworkers, the suggestions, the emails. It really is a wonderful, resource, and then also a community. And I want wanted to also mention that it's so important for parents to talk to parents, and talk to someone who's 5 years ahead, 10 years ahead, because it's all about perspective, and we've all provided each other through CARD so much support. Matt, I wanted to see if you had any final thoughts.
Yeah, I just think, what I'd ask, folks to do is to reach out to your healthcare provider and thank them, right? It's been a tough 18 months for everybody. And when I look across our organization, we see about 400,000 kids a year, which is a lot, right? And so, the impact on our staff and our physicians and our nurses, a big thank you goes a long way, especially in these troubled times. I look at it, we're going to make it through this, right? This is a blip in time in terms of this pandemic. And we're going to be here for a long time. I think the CARD Center will be here for a long time. So I think just a thank you, right? Every once in a while goes a long way, especially to these healthcare heroes that we all talk about. And thank you for having us today, Commissioner. I think it's wonderful that you do these things.
Thank you. And then to wrap up, Dr. Mestre, if you can give us some final thoughts for those parents that still haven't decided to get vaccinated.
Yeah, what I say to them is I definitely understand. I understand the hesitancy, and for those that are speaking with you, just to listen and make sure there's no judgment. There's not a judgment from a moral issue or whatnot, but we understand that hesitancy, and we're here to answer any questions that you may have and to support you in any manner that we can, whatever the needs of your child is. And as we mentioned before, every child is unique. And to the great work that Michael has done with his organization, and I thank Matt Love as our leader here in terms of supporting the organization through this time, and you, Commissioner, for the great work you're doing and being a voice for the children. I thank you all.
Thank you. And while we remind everyone to please speak to your pediatrician, get your information from him or her, not from social media, and please consider vaccinating the neurodivergent people that you love. Thank you, everyone, for being with us. Always